go over these meds. And this is another thing every week look over the old ones, because you'll see these on the whenever we get to the tests in here. So, okay, week 6, Plavix. This is one that is very frequently prescribed again. You'll hear a lot of people take this. Look, it says its classification is platelet aggregation inhibitor. What does that mean, do you think? What do your platelets do? They clot your blood, right? So aggregation just means together, right? Platelet aggregation inhibitor. So what does it sound like it does?
It's going to make them clot together faster, I guess.
If it inhibits aggregation. Inhibits means it what? Yeah, it keeps it from doing that, so it inhibits it. So it's the opposite of that. It's going to make it not clot. They say that it actually works by like making the platelets kind of slippery, or like the blood cells slippery, so that they will like slide past each other. So the reason people take this is acute coronary syndrome, recent MI or recent stroke. PAD is peripheral artery disease. Okay. So anything that would cause, blood clots to form, potentially causing a stroke or heart attack or something like that. So side effects, bleeding. Okay. Obviously, that's going to be part of it. That's its purpose. Is to make it where your blood doesn't stick together. So if you cut your arm or do something, whatever, you're going to have a hard time making it stop bleeding because it's not going to want to clot. It inhibits the clotting. Okay, so, and then look at this other side effect, this TTP, thrombotic, thrombocytopenic purpura. Well, we know what thrombus is, right? What's a thrombus? We talked about thrombosis last year. About quite a bit. Or like a DVT, a deep vein thrombosis. I don't remember any of that. Yes.
They probably do that.
Thrombosis is just a blood clot. Like a DVT, a deep vein thrombosis, is a blood clot in your leg. Thrombo means clot. So thrombotic, thrombocytopenic purpura. So really, really rare, but really serious. I think. I think I know. I just don't want to say it out loud. Oh, wait, here we go. It's a blood disorder that causes blood clots to form in small blood vessels all over the body. It leads to a low platelet count, hence the thrombocytopenia. Okay. Thrombocytopenia, thrombocyte is the same as a platelet, the clotting cell, thromboclot cell, cytocell. So penia or penic at the end of that tells you that it's a deficiency. Now, like we talked about that word before. No, like polycythemia is. It's basically like all of your cells or many cells, Anyway, so it says as the platelets clump together in these clots, fewer platelets are available in the blood and other parts of the body to help with clotting. So it can lead to bleeding under the skin and purple-colored spots called purpura. These blood clots prevent oxygen from reaching these parts of the body. So it's like you have this clotting, bleeding issue, which is kind of strange that it can do both, but anyways. Okay, so precaution says tell patient they may bleed longer and bruise easier. Tell a physician if they have any hematuria, which would be what? Not hemato, that would be hepato. Blood in the urine, yes. Bloody stools or excessive bleeding. So if they've got any of that going on, just tell their doctor. But it's a normal side effect for it to take longer for something to stop bleeding. Like if they get a skin tear or bruise or something, it's normal for them for that to occur. Okay, but to an extent, you know. So look, do not use with proton pump inhibitors. It inhibits the effects of Plavix. It's contraindicated with bleeding disorders, obviously. If they're already bleeding too much, you don't want to make them bleed more. And says administer with NSAIDs, anticoagulants, and SSRIs are an increased risk for bleeding. So any of those are going to increase the rate of bleeding. All NSAIDs have some like blood thinning type of effect, but any other anticoagulants like warfarin or Coumadin, and then SSRIs too, all those can make it for an increased risk. And of course, like I said, special, tell the provider before surgery. And that's for anything that they take to make them bleed. Okay, that's something they would have to be off of before they have some kind of surgical procedure, probably for a couple of weeks. Okay, Singulair for chronic asthma, allergies. Allergic rhinitis is like the medical term for seasonal allergies. Okay, rhinitis is what? Yeah, nasal inflammation. Exercise-induced bronchoconstriction, so it's kind of like exercise-induced asthma. Side effects, they can get an upper respiratory infection. A lot of respiratory type drugs come with the side effect of an upper respiratory infection. I guess that's just because of the effect that they have on them. Flu, headache, fever, cough, sinusitis, otitis media. Let's increase some fluid. But it's not for an acute asthma attack, okay? It won't work. It's not going to work if they're having an asthma attack and they take a Singulair. This is for like a long-term, you know, when you take this over time to get better. It's not a medicine that works like in emergency medicine. So, Sterapred, I can spell that wrong. This is prednisone. It's a steroid. It's for inflammation or swelling. So there's lots and lots of side effects of steroids. But your basic ones are slower growth in children. It kind of stunt their growth some. Fluid retention, it makes people hold fluid, so it can cause edema. Increased appetite, a lot of people gain weight when they take steroids. You'll also notice people can get like a moon face, so it like makes their face really round and puffy because of all the extra fluid. It's kind of a Cushing's syndrome is what it has to do with. Anyways, hypokalemia, so what is that again? Hypo is low, kalemia, kalemia, potassium. Okay, you need to know that word, hyperkalemia and hypokalemia. Hypertension, mood changes, Kaposi sarcoma. The cancer that causes patches of abnormal tissue to grow under the skin, like lining of the mouth, nose, throat. They're usually red or purple patches, and they're made of cancer cells and blood cells. So that's more rare, obviously, side effects on here, but anyways. And then also slow healing, that's something else. Other precautions, increased risk for osteoporosis, infections, because it kind of weakens their immune system some, since it's one of the things that steroids do. And then watch for increased blood sugar. People with diabetes, when they take steroids, a lot of times it really ups their blood sugar, kind of messes with how it works. So that's something to know. Don't want to take it with fungal infections, because fungal infections typically infect people who are already immunocompromised. And so for, if they're battling a fungal infection already, we want their immune system to be working as well as it can. One thing to know too about steroids in particular is that you can't just stop them abruptly. You have to wean people off of them. So a lot of times, like if somebody's had an acute asthma attack, they'll take steroids for a little while. So they may take 4 a day for 3 days, and then they'll bump down to 3 a day, and then they'll bump down to 2 a day, and then they'll bump down to 1 a day before they quit it. And that's pretty standard with steroids. You want to bump them down. You don't want to just quit taking them all of a sudden. Okay, Lexapro, escitalopram, This is an SSRI, and it's for major depressive disorder or generalized anxiety disorder. That's what that GAD is. MDD, major depressive disorder, GAD, general anxiety disorder. Side effects: dry mouth, nausea, diarrhea, sweating, dizziness, fatigue, insomnia, ejaculation disorder, decreased sex drive, hyponatremia. What would hyponatremia be? Low sodium. So again, risk for worsening depression and for suicide. Same thing with all antidepressants. This one has an increased risk of bleeding with NSAIDs. It's contraindicated with MAOIs. And again, gradual reduction. Most medicines you need to gradually reduce, but there's some specifically. Any kind of psychotropic drug, like I said before, that they've been taking they need to be weaned off of it instead of just stopping all of a sudden. Unless there's like an allergic reaction or, they're having like an acute issue with it. Advil and Motrin, these are brand names for ibuprofen. It's an NSAID. Everybody remember what NSAID stands for? Non-steroidal anti-inflammatory. Okay, non-steroidal anti-inflammatory. That means it decreases inflammation, but it's not a steroid. So it doesn't have all the side effects that steroids have, but it can still decrease inflammation. So this is for mild to moderate pain, rheumatoid arthritis, osteoarthritis, dysmenorrhea, which is just like the menstrual cramps. Dys means bad. Side effects: GI upset and ulceration and bleeding. So anytime NSAIDs are mixed with some medicine that would make you bleed, okay, you're going to have increased bleeding because NSAIDs make you bleed. Same thing with an ulcer. They can really irritate the lining of the stomach. So a lot of them are coated. Advil kind of has that like candy coating on it. Increased risk for heart attack or a stroke. CEA, remember, stroke, cerebrovascular accident, which is kind of interesting because it makes you bleed, so you wouldn't think that. Anyways, may worsen or cause hypertension. Long-term use may cause renal problems. So these really are kind of hard on your kidneys. So you don't want to take too many of them at one time. Diminishes the effects of ACE inhibitors. Inhibits methotrexate. It's one we've had, I think, last week or the week before. Increased bleeding. Contraindicated with the cabbage. Y'all remember what cabbage is? No, lots of it. Coronary artery bypass graft. Remember that? That's open heart surgery. Like whenever they replace those blood vessels, when we talked about that on pregnancy category C, not really recommended. Okay, Celexa, citalopram. This is another SSRI, so it's going to have a lot of the same type of effects as Lexapro we had a while ago. Major depressive disorder, generalized depression, arrhythmias, somnolence, which means it's going to make them sleepy. Sleep. Dry mouth, nausea, diarrhea, sweating, dizziness, fatigue, insomnia, ejaculation disorder, decreased sex drive, hyponatremia. Same side effects, basically. Again, with the risk for worsening depression, like all antidepressants have. Watch for arrhythmias. This one specifically has arrhythmias. Contraindicated with MAOIs. Again, all SSRIs are contraindicated with those. And then increased risk of bleeding. Same idea. ProAir is albuterol, and there's lots of brand names for albuterol, but ProAir is one of them. So bronchospasms or exercise-induced bronchospasm, so exercise-induced asthma. A spasm is just like a clenching kind of a muscle. So when you think bronchospasm, that's like the closing, like a sudden kind of closing of the bronchi. Okay, it's just like irritated and kind of like clamping shut. It's not good. And then acute asthma. So these can cause tremors, nervousness, headache, increased heart rate. It kind of makes people really jittery. A lot of times when they take albuterol, really increases their heart rate, big time. Monitor for paradoxical bronchospasm. So that's one thing to watch when people are taking albuterol is it can actually, and this is like not a common side effect, but it can go the other direction. I guess maybe, I don't know, Don't give with beta blockers. What are some beta blockers? What do they end in?
LOL.
LOL, yes. Okay, so those are usually for hypertension or heart problems. And it makes sense because, look, these are beta 2 receptor agonists. So they make the beta, instead of like they're agonists, whereas a beta blocker would be an antagonist, a beta antagonist, because it blocks it. That makes sense? So they would be working against each other. Usually comes in an inhaler, but it can be in nebulizer form too. Prozac is another SSRI, so lots of those on this one. Same ideas as far as the side effects go, same ones that we've talked about on the other SSRIs, but this one is for major depressive disorder, OCD, obsessive compulsive disorder, bulimia, panic disorders. A lot of times it's used in combination therapy with bipolar. So again, with the precautions, worsening depression, risk for suicide, contraindicated with MAOIs again, gradual reduction. So pretty much all those SSRIs kind of have the same side effects, same precautions with them. Neurontin or gabapentin. This is an anticonvulsant, but it actually can be used for some other things. Neuralgia. What would neuralgia be? Neuro is what?
Nerve.
And algia is
Pain.
pain. So nerve pain. A lot of people take this for nerve pain. So, and they say nerve pain is pretty, yeah, I mean, obviously it's painful, but it's kind of like, a lot of people get this with diabetes. They get neuropathy, so they get nerve disease, and it causes almost like they are, it's like, I don't want to say like they have a short in them, but kind of that same idea. It's like they're really irritable. We talked about how nerves can be irritable and their conductivity and all of that. Well, it's like they're overly excited, overly stimulated. So I remember a lady, and I've probably told you all this before too, but I had a lady one time who had really bad neuropathy related to her diabetes, so much so that she could not stand anything touching her feet. Even sheets laying on her feet really hurt. I mean, it was painful. So, that's the kind of pain. Also for epilepsy, so it also works as an anticonvulsant. We talked about this medicine when we did the CNS meds the other day, last week or week before. Dizziness, somnolence, so makes them sleepy, edema, ataxia, which is difficulty moving, okay? And then nystagmus, which is, we talked about this the other day too, it's where your eyes twitch. Increased risk of viral infection, suicidal thoughts, and ideations. It's a psychotropic med too. It can have that effect. So definitely want to gradually reduce that. And then the last one here is Coumadin. The generic name is warfarin. This is one you will see a lot. You'll see this a lot. It's very commonly prescribed. It says prophylaxis or treatment of venous thrombosis. So people have had a DVT. It's something that they can take. It's like a really intense kind of anticoagulant. I mean, that's what it's for. It's to keep your blood from clotting and causing clots. Pulmonary embolism. And we talked about last year the word thrombosis versus embolism. A thrombosis is like a blood clot in the leg. Okay, and embolism is where part of that blood clot has broken off and exploded to a different area. So pulmonary embolism would be a blood clot in the pulmonary? Lungs. Okay, so the embolisms can be caused by loss, and you can have an air embolism, like if somebody lets, and like IV tubing full of air go into somebody's body, that's an air embolism. They can have a fat embolism where some fat breaks off and gets in their bloodstream. There's embolism can be lots of things, but that's just that it's moved from somewhere else and gone to that area. So if they've had that, this can be a medicine that they give for that. Thromboembolic complications related to atrial fib or valve replacement. So atrial fib, you all remember what fibrillation means? Okay, you know how your heart, it should just pump consistently. Fibrillation is where it just kind of quivers in place. It's like the muscles are kind of like spazzing. I remember talking about that now. Fibrillation. I think it's one of our payday terms last year. Okay, atrial fibrillation is where the atria fibrillate. Okay, so the top two chambers of the heart, and they actually just quiver in place. That's all that they do. Well, in light of that, okay, blood is not being pumped the way it needs to because the heart's not filling up and then pumping, filling up and pumping. So, I mean, blood can still move through, but it's just like moving through, at like a weird rate, if you will. And so the problem is blood can sit inside that chamber. Well, when blood sits somewhere, what does it do? It clots. Okay? If it's not constantly moving, it's going to clot up. Well, that can cause blood clots, in that blood and then travel to wherever else. So that's what it's talking about. So complications related to atrial fib or valve replacement. So same idea. They replaced a valve, and sometimes valves can really easily cause clots. New valves, just because there's something that's new, they're not kind of like your natural body parts, and so blood tends to stick to them. So a lot of people with valve replacement will take high doses of Coumadin. And then a post myocardial infarction risk, post MI, that should be there, or a risk of MI or cerebrovascular accident. So if they have a risk of those, they cannot take this medicine. Okay, so obviously a side effect is bleeding, bruising, hair loss is another one, fatigue, change in taste. Okay, so look at the precautions. Monitor INR frequently, daily at first, and then regularly as needed. So they usually do what's called a PT INR, prothrombin. INR is international nationalized ratio. It's something. But anyways, basically a PT and INR measures how fast your blood clots. Okay. So they look at these numbers. It's blood work, and you have to go and get blood work done. They look at these numbers, and there's a very specific range in which they want your blood to clot, like this very specific time period that they want your blood to clot. And this number kind of gives you a good picture of that. And so what they do is they want it to be in that therapeutic range. So they constantly check and make sure that it's, it's slow enough, but it's not so slow that you're going to risk bleeding out somewhere else. They want it in that specific range. It's very narrow. And so a lot of times, especially after people first start on it, they'll have to have their blood checked every day until it kind of gets under, they can get it into a good place, and then they might check it every week or every 2 weeks. And they make changes to that medicine constantly. Increased risk for release of Arthur emboli, so like a breaking off of plaque that's in the bloodstream that can cause that. Tissue necrosis, really rare risk. Necrosis, remember, is death. And then liver function, you need to monitor that. Okay, multiple interactions. You're going to see, if you looked up contraindications with Coumadin and warfarin, there's lots and lots of them. Increased risk for bleeding with other anticoagulants, any other antiplatelet medicines, SSRIs, NSAIDs. Don't want to take it if they already have a bleeding disorder of some sort. Pericarditis, any surgery, they would have to be off of it for a long time before, a couple weeks. Okay, look, monitor with vitamin K, foods, and meds because it will decrease the effectiveness. So anything with vitamin K, like green leafy vegetables, spinach, all those foods are high in vitamin K, okay? And that will make it not work. So usually what they tell people when they start on Coumadin is they will say, okay, just don't change how much you eat. If you eat a salad every day, then keep eating a salad every day. Okay? But don't change, don't one day go crazy and eat vegetables all day long, or foods that are high in vitamin K all day, because it's going to mess with how the medicine works. So also vitamin K is the antidote. So if somebody has taken too much and their INR is sky high and they're bleeding everywhere or whatever, not really if they're bleeding everywhere, they have to go to the hospital, but if their INR is really, really high, then vitamin K is actually what you give them to make it come back down. So it's also the antidote. It comes in tabs. The injection, usually I haven't seen Coumadin used a whole lot injection-wise. Usually they use heparin, which is another anticoagulant. But pregnancy category D, okay, anything that affects how you bleed is going to affect pregnancy because of the increased amount of blood in the body system, plus the fact that the placenta has so much blood flow that goes to the baby. So any medicine that you take that's going to affect blood flow is going to affect the baby as well. Don't change other meds, monitor for noncompliance. And then bleeding. That's one thing I always tell people if they're taking Coumadin that's new. Say, make sure you watch urine. Make sure you don't have blood in the stools, because that's a sign that there's too much. And then they're bleeding elsewhere, bleeding out in their kidneys or whatever. And then the skin too. Sometimes if their INR gets really high, if they've got too much of it in their system, they'll break out in like little bruises all over the body. Anyway, so that's that. Coumadin is, like I said, really one in here that you'll hear a lot about, and you'll see a lot on the test. Okay, so